We will get started in just a moment. We are waiting on two more of our panelists. Dr. Guralnik is here. Thank you so much. Joining from, yep, great. Glad to have you. If you are just joining, we're dropping into the chat where we're joining from. I'm in North Carolina, and what was of interest to us about this webinar specifically. Appreciate your patience while we gather, and I'm going to do a quick intro here in just a minute too. We can get started. Okay, let's go ahead and get started, you guys. I see about 65 attendees. That's amazing. Appreciate you all being here. Charleston, South Carolina. Thanks, Karen. San Francisco. Thanks, Rachel. Awesome. Okay, so we're all gathered here together today to talk a little bit about stress and burnout at work. We have about 45 minutes set aside for this, and we will be respectful of your time. And we do have three speakers, three different kind of subsections on workplace burnout that we're going to go through. You can see our speakers here: Dr. Orna Guralnik, Dr. Jesse Saul, and Lorena Gonzalez. We'll be talking about different things. Before we jump into kind of the meat of the webinar, I wanted to share with you just very briefly, and many of you have already shared in the chat, your reason for being here is either that you have recently burned out and changed jobs, or you're starting to feel burnt out. And so in that same vein, I'll just share quickly my story around burnout and why this is so meaningful to me. About this time last year, I was working for a large public organization in a leadership position, a lot of stressors, I would say. I was managing my team, managing a large budget, travel commitments, probably like a lot of you, honestly. And I started to notice some weird physical feelings in myself that I had never noticed before. First, it was kind of this weird chest pain. Sometimes I would have a hard time catching my breath. It was like very, very new for me. And then the most noticeable change for me was sleep at night. I would lay in bed and just lay in bed and not fall asleep. And it was a new feeling and a very weird feeling, unwelcome feeling. And then one Thursday morning, I was on a normal HR call with one of my partners, and I just broke down. I just, for no good reason, seemingly started just crying, just uncontrollably. I had to leave the meeting and take the rest of the day off. And it quickly dawned on me that something wasn't right, and work should not be making me feel this way. So I was able to take a 30-day leave of absence. I spent that time, I started a relationship with a counselor. I talked to my PCP. I was doing a lot of walking, reading books. And if you haven't been able to take any time for yourself to kind of reset and reevaluate, would absolutely encourage that. For me, the decision was made at the end of that 30 days to leave my job. It was taking too much time away from my family. It was causing physical unwellness, mental unwellness, and ultimately it was putting me in a place where I wasn't going to be healthy long term. So I left that job. And our data shows that about 20% of people in the workforce today are voluntarily leaving their jobs because of burnout at work. So 20% is a lot when you think about being a people leader and the cost of onboarding and offboarding resources. So that's a little bit about me. I appreciate you guys, your patience in letting me share that. I feel so much better today. I'm really glad that I went through that so that I can know kind of what to look for next time. But hopefully you don't have to go through that maybe to the degree that I did. Today's webinar, we want to focus on three objectives. So we want to understand the difference between stress and burnout. We want to gain insights on ways to help you and your employees manage stress. And then we want to discover how to give employees access to clinical and evidence-based support. So enough from me. Without further ado, I want to introduce you to Dr. Orna Guralnik. She is a clinical psychologist and psychoanalyst who practices in New York City. She's on the faculty at NYU Postdoctoral Institute of Psychoanalysis and at the National Institute for the Psychotherapies in NYC. Dr. Guralnik lectures and publishes on the topics of couples treatment and culture, disassociation and depersonalization, as well as culture and psychoanalysis. Thank you so much, Dr. Guralnik, for being here. I'm going to turn it over to you now to talk about what is burnout.
Thank you, Lauren. I'm going to speak a little bit from the perspective actually of a psychoanalyst, which I know is an unusual perspective to bring into this kind of work situation, but I think it is helpful to think this way and talk about, typically people think of burnout as some kind of cumulative problem. There's too much stress, like there's ongoing too much work, too much stress, no time to rest, no breaks, just as almost like a mathematical issue of like too muchness. And I thought it might be interesting to think a little bit, to dig a little bit under the surface into like this question of burnout. Lauren, you were describing something that we call in jargon conversion symptoms, where the body starts to say things that the mind isn't paying attention to. Like when the mind doesn't process things, it all goes into the body, and the body starts to show symptoms that ultimately you want to translate all the way back to the less conscious reasons. And there are a few things that I can talk about in terms of like what people that I see, patients that I see, discover when they do a more psychoanalytic exploration of like burnout. So one of the things that happens for people at work, in addition to working hard, and we're all living under the, well, I don't know if all of us, but I guess there are people from all over the world here, but at least people who are similar to the work environment that we're in here in the United States. I mean, the premise is like, a pretty extreme capitalist idea of what work is. I mean, the individual is basically part of the marketplace, and they need to work hard to produce for the marketplace, for the shareholders, which is really the marketplace. So it in a certain very basic way, what people discover at work is that they are depersonalized. They're like a cog in the machine, and they stop feeling like a fully functioning individual. They just feel reduced to being a piece, which is demoralizing, dehumanizing, depressing for people. And people don't always know how to think about it because, people are just, they're working. They're not thinking, oh my God, capitalism and what is it doing to the individual? And so that's just the general context. In addition, one of the things that happens is what we call in psychology the experience of learned helplessness, which is no matter what people are doing, there's a certain kind of way that they are either not having enough of an impact on whatever they're working on the person they're working for themselves. They're not managing to change things enough, and they start to feel helplessness, which is like the number one cause of depression. In addition, people often complain about not feeling seen or recognized by the people they work for. And people have like intense projections onto their boss and onto their workplace, their work environment, in a way as if it's their family. And they want to feel seen and recognized as individuals. And an ongoing experience of not being seen, like whatever they're doing is not a real contribution, whatever they need, whatever they're contributing is not being recognized as an individual contribution. The boss or coworkers, the executive team, whoever it is not seeing them as individuals. And they don't feel like they matter, which is another contributor to burnout. And the last thing I'm going to say, which I think really in my mind is the most important factor in burnout and in what people can do to change things around, is that the kind of thing that makes people excited about what they're doing is a correlation between their efforts and what they get back. So for a student, it would be like putting in the work at studying for, let's say, an exam, and then getting the results in the form of succeeding on that exam. Or putting in an effort in terms of your relationship with your boss and seeing that that is indeed showing up in your boss, like having a better relationship with the boss, or your boss promoting you, or any kind of like feedback, or putting in some effort in terms of like the product you're working on and seeing the product grow. So this correlation between effort and result is huge in terms of like what matters to people in their work environment. And if I had to talk about like one factor that is like crucial in terms of burnout, is when that correlation is disrupted, when effort is not yielding results. And that is like the number one cause of burnout. So I will stop there.
Thank you so much, Dr. Guralnik. I think that's really insightful. And guys, attendees, you can feel free to drop questions in the chat for Dr. Guralnik. We'll come back to those at the end. One quick question for you now, while we have a moment though. Would you have a recommendation on how folks can be seen and feel recognized and feel appreciated? Is there a way for them to take ownership in that?
I mean, it's a give and take between whoever the individual is and whoever they're working with. But what people can own is, first of all, the feeling that they're not being seen, that that's bothering them. And then think about the people, who are the people they want to be seen by, and try to tailor their ask to who are these people, what do they need, like what is the back and forth between them and those people. And try to, in a way, operationalize what would it mean for them to be seen, and talk to whoever they need to talk to about like, okay, what do you need from me, so that we establish this kind of correlation between my effort and you seeing me.
Mm-hmm.
Make it explicit, operationalize it.
Yeah, thank you so much. That's really helpful. Again, guys, if you have questions, drop them in and we'll come back. We'll circle back. We're going to keep going now. I'm going to introduce you to Dr. Jessie Saul. She's bringing to us today her 19 years of experience in research, program evaluation, and strategic implementation around tobacco cessation. Dr. Saul has applied her deep understanding to improve the X program performance and reduce tobacco use across different populations. She earned her PhD in Science and Tech Studies from Cornell, and she's now the Director of Strategic Insights for the X Program by Truth Initiative. So without further ado, over to you.
Thanks, Lauren. I'm really excited to be a part of this panel today, talking about burnout and stress and addiction. And the information that I'm bringing to this conversation is really focused on tobacco addiction, nicotine addiction. But I think it really applies to any type of addiction, and this relationship between addiction and stress in particular, but also the relationship between stress and burnout, as Dr. Guralnik was just talking about. So we're really excited to be a partner with Sesh because of this interconnection between addiction and mental health. I want to say just a little bit about who I represent. So I work with Truth Initiative on the X program. Truth is the largest nonprofit public health organization that's focused on eliminating the harms caused by tobacco. We were established in 1999 as part of the tobacco use settlement. And we do a lot of work with youth prevention. That was sort of the initial mission of Truth Initiative, but we've expanded into an extreme amount of tobacco research, as well as policy efforts and community activism. We work with communities directly to really advocate for different efforts around tobacco prevention and cessation. And the work that I do with the X program is focused on adult cessation, but is something that works with adults to really address this tobacco addiction. So just briefly, the X program includes a personalized X plan, a way to tailor that information to create something that's unique to each tobacco user. We provide expert support through our X coaches, trained X coaches, through our chat feature, as well as an online, it's the longest running community of real tobacco users who are online, who are either quitting or helping each other stay quit. And then we also provide interactive tailored support through text messaging and emails. And we ship nicotine replacement patches, gum, and lozenges directly to people's homes. So through our partnerships with folks like Sesh, with health plans, employers, and health systems, we've made the X program available to over 10 million adults in the US. And we also partner with the Mayo Clinic. We are the digital extension of their clinical program, and we've been working with them for over 14 years to create this digital version of their clinical intervention. It might surprise you to know that over 19% of US adults still use some form of tobacco product. That means over 46 million Americans are still using tobacco. We know that most adults are using some form of cigarettes, commercial cigarettes, but we know that e-cigarettes, vaping is something that is rising and is the most commonly used product among youth and young adults. And it's something that we are going to see move up into the workforce as that age group comes up into working age. I want to highlight this relationship between tobacco use and mental health. And now this graph shows a really specific snapshot about the relationship between tobacco use and anxiety. But this kind of relationship applies across the board for any type of tobacco product and any type of mental health. We know that the more severe a mental health issue is and perceived to be by an individual, the more likely they are to also use tobacco products. And I'll talk about why that is in a little bit, but you can see here that if you are reporting severe anxiety, 45% of those who report severe anxiety are also using tobacco products, some form of tobacco products. And whether that's cigarettes or e-cigarettes or some other form of tobacco, that's the relationship that we see. And it's something that is really important to understand as employers who are dealing with burnout. We know that stress is a trigger for tobacco use. And we also know that tobacco use makes mental health conditions and symptoms, it exacerbates those, it makes them worse. And so if you have anxiety, you might be using tobacco to self-medicate and make you feel better. I'll talk a little bit more about that in a second. But we know that in actuality, it's going to make those anxiety symptoms worse. It's going to make stress worse. We know that nicotine dependence is an addiction. It's not a lifestyle choice. It's not something that you just do on the weekends or when you feel like it. This is an addiction and it changes your brain, which makes quitting really, really hard. Fewer than 1 in 10 are going to succeed if you are trying to quit using tobacco on your own without any form of assistance. We know that only about 1/4 of tobacco users use some form of assistance when they're trying to quit. It's one of the most difficult kinds of addictions to break because of how it changes your brain, because of the nicotine receptors that get developed when you're using tobacco repeatedly. Most people relapse within about a week or just over a week when they're trying to quit on their own. And people have to quit a lot of times. They need to practice this as a skill in order to be successful at their quit overall. So we talked a little bit about this correlation, this relationship between tobacco use and mental health conditions like anxiety. I said a little bit before that people use tobacco to self-medicate. People feel withdrawal symptoms. Once you become addicted to nicotine, you go through this cycle of withdrawal. So when the nicotine wears off, you start having withdrawal symptoms, and they feel an awful lot like an anxiety attack. Your heart rate increases, you get jittery, you get restless, you have an inability to focus or concentrate, you might have trouble sleeping. Whatever those feel like, you might get a headache or nausea, they're unpleasant symptoms. And when you use tobacco, those symptoms go away in the very short term. However, even though it feels like you're feeling better, the smoking and the nicotine exposure over time actually causes stress, because this cycle of withdrawal that you go through with, I feel worse, I feel worse, I feel worse, I use nicotine, I feel better, I feel worse, I feel worse, I feel worse, I feel better, that you go through that 20 times every day. And that roller coaster of emotion, that roller coaster of physical symptoms causes stress, both physiological as well as emotional. And when you do that over and over every day, that stress starts to wear on you. And of course, it doesn't seem surprising then that tobacco users report poorer mental health than those who don't use tobacco. Now, the great news is when you quit, your anxiety, your depression, and your stress levels all go down, and your mood and your quality of life measures all go up. And those changes persist for as long as your quit does. So this is the important takeaway message that I really want to get, make sure that people are understanding, that tobacco use is often a trigger stress is often a trigger for tobacco use, but tobacco use actually causes stress and quitting reduces it. So when we're talking about burnout, it's really important to be able to meet people where they are, to be able to understand that quitting tobacco is a way to give people control over some of this, this stress, this environmental impact on their mental health. We know that tobacco users want to quit. 68% of smokers want to quit completely, and nearly that number of vapors want to quit. So that's the really good news. We don't have to do anything to convince people that they should quit. They already want to. And so it's really up to us as employers and as mental health professionals to be able to provide them with resources that are effective, that are easy to use, and that are available 24 hours a day, so that they can quit when they want to and they can get the help that they need. So we have a couple of things that I want to highlight here in terms of practices that really drive success, that meet people where they're at, that help them take control and feel like they have some control over some of these factors in their lives, so that they can quit tobacco and they can improve their mental health. To make sure that people have a comprehensive policy in place that that disallows tobacco use in the workspace, both indoors and on campus, that makes it easier for people to not slip back into old habits. These tobacco use resources, tobacco cessation resources, need to be available to all employees and their dependents. It's a lot easier to quit if the people that you live with are also quitting at the same time. If you have a tobacco use surcharge or some kind of incentive, we have clients who use contests and promotions to really promote this kind of a program and a resource. Using promotion throughout the year, making sure people are aware that these types of programs are available, and being promoting it in many different ways, whether that's emails or posters or at-home mailers, those kinds of things. So these are just things that, again, if you're working with a vendor to provide tobacco cessation services, it is a way to help improve your employees' mental health, but it's also important to make sure that you're asking the right questions, that they're providing you the resources you need as an employer to make this kind of a program successful.
Thank you so much, Dr. Saul. I'm going to save a few of these slides. We can circle back to them if that's okay. I want to make sure we're leaving enough time for Lorena and for questions that might be coming in through the chat. So, and just to everyone out there, we will be sharing all of these slides out after today's webinar with some Q&A too. So don't worry, we will get you this really helpful information. But I'm going to pivot now to another section presented by presented by our licensed clinical mental health counselor, Lorena Gonzalez. Lorena is a licensed clinical addiction specialist and a clinical supervisor intern in North Carolina. She specializes in treatment of trauma, depression, anxiety, and other mood disorders in adolescents and adults, as well as the treatment of drug and alcohol abuse and other addictions in civilians and active duty military. Lorena is joining us here today with her 17 years of experience. She's going to be talking to us about job burnout being similar to smoking, how to help employees manage stress, and then how to support your employees' mental health. So, Lorena, I'm going to pass it over to you, and I appreciate your time. You are muted.
Yes,
okay,
sorry
there you
about
go.
that. I had
There
to
you
unmute
go.
myself. So thank you, Lauren, for that introduction. And wow, what a great presentation by the two ladies before me. I'm so grateful to be here today to join everybody on this presentation, this webinar about burnout and how it's similar to smoking. So let me go ahead and get right into it. Smoking and burnout both contribute to cardiovascular issues. They have similar outcomes with other health issues, including fatigue, insomnia, high blood pressure, and lower the ability to heal or resist infection. So all of those things were very eye-opening to me because as a former smoker, I never really thought about any of that stuff. So just seeing that there, I love that we can put that there for people to visually see some of the similarities in cardiovascular issues. So tips to help employees reduce stress and avoid burnout. Before I get into that, I just wanted to share a quote that Dr. Jessie Saul shared in her article that I read about the similarities between burnout and secondhand or smoking. And it says that one study found that observing someone else's stress, what researchers call empathic stress, can increase the risk of stress-related diseases such as heart disease, asthma, diabetes, and depression and anxiety. So it's kind of like vicarious stress. You see somebody stressed and you kind of take on that stress as well. So it also does affect your physical, emotional, and mental health. So tips to help employees avoid or reduce stress and avoid burnout. One study conducted at Michigan State University in 2022 found that if you get your meetings outside, you get some fresh air and some sunshine, that helps boost your employees' mental health and productivity. And you can even engage them in walking meetings, but just as long as you make sure that, everybody's paying attention and involved in the meeting. Employers can encourage time with a support system and encourage self-care also by showing the employee that they themselves are doing it, engaging in self-care. That's a great way for them to help reduce the stress of their employees. They try not tasking the employees with too much work that causes prolonged hours and high levels of stress to get the work done. One thing that I found is encourage vacation time. That was surprising to me that in a study in 2017, they found that 52% of American workers failed to use all of their vacation time. 52% of people were not taking vacations or not taking all of their vacation time. And it's funny, as I was putting this together, I had a client tell me that her husband has 10 weeks of vacation stored up. And I thought, wow, when was the last time he took a vacation? But, flexible scheduling, I was just thinking about that with after COVID, so many employers offering, remote work or a combination of remote and office work. And I think that's a great way for employers to help reduce stress in employees, especially for people that have scheduling conflicts like with daycare or taking care, caregiving with somebody else. I think that's an excellent way to help reduce that. And I had a little exercise plan for everybody. I'm just going to give you a clipped version of it because we don't have a lot of time. So essentially it's called scanning the body. And you just start with, we're going to start with the bottom foot, scan it, see how it feels while it's on the floor. And you're going to scan your toes on that left foot, each toe individually, and then the whole foot together. And then move on to the right foot and do the same thing. And so essentially what we're doing is mindfully paying attention to what our body is telling us as we're sitting long hours during the day. And it may be telling us to stretch a little bit, get up and move your body, take deeper breaths, turn to the left, turn to the right, and you want to go through your whole body, your feet, your calves, your legs, your torso, each individual arm and hand and fingers, up to your head, your eyes, your mouth, everything, to just check in with yourself and see how it feels. And then also, once that is done, you can go into progressive relaxation, which is just taking those body parts, and you would say, okay, both feet, squeeze, 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 squeeze as tight as you can your feet, and then relax them. And then you're going to go on to doing the same thing with your calves, squeeze, and your leg muscles, squeeze them as tight as you can, both legs together, and then relax them. You're going to squeeze for about 5 seconds total on each body part, and then relax. And that exercise, both of them, the scanning, the mindfulness exercise, scanning the body, and also the progressive relaxation exercise, takes 5 minutes total, the length of time it takes to smoke a cigarette. So employers can encourage their employees to do this every hour for 5 minutes, check in on themselves, scan their body, and then try to do a little bit of stretching or movement, deep breathing, to get yourself back into productivity mode. So easy strategies to best support your employees' mental health. I think one of the easiest ways is by being the example, showing your employees that you take care of yourself. Be open and transparent about how, yes, I struggle too with anxiety. I struggle too. You don't have to get into detail with them, but just let them know that you understand where they are and you can normalize that feeling, and also encourage them to, take note of what they're feeling and maybe write about it, or engage in some kind of group support, like Sesh offers group supports that you can join other people in understanding your anxiety better, or your stress and burnout related symptoms better. Another great way that I saw was check in with employees. Employers can definitely check in with their employees, and they don't have to have an in-depth conversation, but a little more than, hey, how's it going? How you feeling today? How are things going with the workload? How's your schedule? Do we need to make any adjustments? Just those little 5-minute check-ins help go a long way. Even if the employee doesn't need anything, it allows them to feel seen and heard by you as an employer. Be flexible again with the scheduling. If they need to come in at 11 and leave at 7, or work a couple days at home and a couple days in the office, be open and flexible about that, and try to work with them instead of make them feel like they can't come to you. I think one of the greatest things that I saw, and because I'm a licensed therapist, I have to renew my licenses regularly, is invest in trainings. If employers are able to bring trainers to the office, make it less stressful for employees to have to go to a training, fabulous. If they can offer it online, fabulous. Those are all great ways to support mental health in the workplace with employees.
Thank you, Lorena. That's amazing. You finished exactly on time. I appreciate that. Really good tips there for how we can support our employees at work. I'll just quickly mention again what Lorena touched on, which is Sesh, who's co-sponsoring this webinar today with the Truth Initiative and the X program. We offer virtual group support in an employer model. So, this is a benefit you can purchase for your employers or your employees, a safe private space, a HIPAA compliant space for them to come and connect with others on topics like workplace burnout, anxiety, stress, addiction. We offer over 400 sessions a month. We have over 130 licensed clinicians in our network, same day access to those group sessions that we mentioned, and you can access it from anywhere you have a phone or computer. So really excited to be here with you guys today. The clinical outcomes that you see on the screen will be in the slides for your review, but our findings do show a reduction in stress and anxiety after your first 3 sessions. So with that, I'm going to open the floor. We have about 7 minutes. I'm going to open the floor to questions. There's a couple that have come in. I'm going to go back to the first one I saw, which was from Juanita. And I know, Dr. Saul, you mentioned quick notes. Maybe you want to expand on that. But Juanita says, food is my tobacco. What is a better way to deal with anxiety and stress?
Yeah, the answer I put in the chat was just noting that mindfulness exercise, checking in, what is the trigger? This is one of the things we do with tobacco addiction as well. What's the trigger that's creating the anxiety or the stress? And being able to identify that, and then just do that mindfulness exercise, that check-in of being able to feel what's happening in my body. And sometimes just doing that is enough time to kind of let that pass. And it's a little bit easier to decide to do something else when you're not quite in the middle of the emotional response to whatever's going on.
Mm-hmm. Yeah, thank you so much. I hope that's helpful, Juanita. Dr. Guralnik, for you, Rachel says, for efforts versus results, how do you deal with controlling what you can and also not ceasing to make an effort while also respecting our boundaries?
Sorry, Lauren, can you repeat that?
Sure. She wants to know, how do you deal with controlling what you can? So maybe we'll take it in 2 parts. How do you deal with controlling what you can and not giving up on making an effort? Let's do that first part. Controlling what you can and not giving up on making an effort.
I'm not sure I understand the question, but I think
this was in, yeah, go ahead. Sorry.
One of the things that happens is, first of all, identifying that break in correlation, identifying, oops, my efforts are not yielding the results I was hoping for, is already important. And then some of it has to do, first of all, with a person's relationship to reality. Am I putting enough effort? Am I putting too much effort? Is what I'm looking for as a result not possible? Is it not up to me, actually? Is there some systemic issue that is preventing it from happening? Meaning there needs to be kind of an honest analysis. But I think once you, first of all, diagnose that correlation is not happening, there's some break there, then you can start analyzing what has to do with me, what has to do with the system, how can I create a situation where that correlation is reestablished.
Okay. I hope that's helpful, Rachel. If you have more context you want to share, please do drop it in. Thank you so much, Dr. Guralnik. Someone else says in the Q&A box, how do you feel culture contributes to stress and burnout? Lorena, maybe you want to take this one. How do you feel culture contributes to stress and burnout?
Specifically the workplace burnout culture or the workplace culture, it can be, depending on, how large the company is, it can be very loud in some areas if it's an open like cubicle area and there's a lot of noise going on. I think that can contribute, maybe a competitive culture can contribute to workplace burnout and stress. So I think what she's asking is, how does culture contribute to it? As a mental health therapist, I think of many different cultures, environmental factors, social factors. that specifically in the workplace, I know if there's a competitive environment in the workplace, it can contribute to high levels of stress and anxiety and then to burnout. And so quickly, I just think about Brene Brown and how she said when she was doing qualitative research on stress and anxiety or stress and workplace, she rode the elevator up and down in a law firm and she would hear the guys competing with each other. So how long have you been here? I've been here all night. Well, I never went home. I came back at 5 o'clock in the morning. And so they're constantly pushing themselves. But then you get 10 weeks of PTO and it's not used, or an environment where they're competing, butting heads all the time. So maybe don't not contribute to a competitive environment, but don't condone it. It's not okay.
Yeah, that's helpful. Dr. Brown has a lot of good insights there. Lorena, I'm going to point this question seems, Dr. Saul, like it would be a good one for you. I think it goes to some of the things you were saying earlier. Claire says, does everyone who suffers from burnout have depression on some level, in your opinion?
Oh, it's a great question. I don't think that it necessarily is a one-to-one correlation. I think it definitely feeds in. What the question was, does everyone who has burnout also have depression?
Yeah, in your opinion, yes.
Yeah, I think it's definitely a contributing factor, or can be. I think that when you feel like you don't have control over workplace stress, then that can lead to depression or make existing depression worse. But I don't think it's necessarily a one-to-one or a causal factor for everyone. But it certainly probably is more prevalent. If you're feeling symptoms of burnout, then you may also be feeling symptoms of depression or anxiety or other types of mental health concerns.
Yeah, great. I'm going to take one last question here. I know we're going to be up on time and we do want to be respectful of everyone's time. I'm going to summarize what came through in the chat. Hopefully that's okay. There was some context given. Essentially, Paula's partner is working a lot, working extremely hard, burning out, not taking great care of him or herself. So just, I think Paula's asking any ideas for how to encourage her partner to take better care of themselves. Dr. Guralnik or Lorena, one of you maybe wants to take this.
I can go ahead and respond. I think the best way to encourage somebody is to have just little steps, little things that you change. Hey, I noticed that you don't drink a lot of water. I think more water would help you feel better physically. And then when you feel better physically, you feel better emotionally and mentally. Let's get together and talk. If it doesn't necessarily be about share your whole complete feelings with me, but tell me what's going on. I see you stressed out. What can I do for you? You want to go for a walk outside? We can talk about it. Little thing. I think sometimes we look at an overall goal and want to resolve the problem immediately, but little steps make a big change. And I think if we can look at the bigger picture and break it down into a smaller picture to build it, then just that way encourages it. Don't offer so much at one time, just add something once a week or every week.
Thank you. Yeah, the little stuff adds up. Oh yeah, go ahead. Sorry.
Just one other piece really quickly. I think that's exactly right. And if you're trying to help someone, whether it's with addiction or whether it's some other kind of just self-care, we've got some great resources on thexprogram.com for advocates, partners, parents who are trying to help their loved ones deal with nicotine addiction. And I think those skills are really applicable and transferable to other areas too.
Thank you. Thank you guys for your time and attention today. We'll be sharing out the deck, the recording, as well as a brief survey. I mean, when I say brief, I mean like 3 questions. We would love your feedback on that. And again, just thank you. Thank you to our panelists, Dr. Saul, Lorena, Dr. Guralnik. Really appreciate your time and your preparation for this. It's been a pleasure. Thanks, guys.
Thanks, Lauren.
See ya.
Thank you.